ITS in collaboration with ASST Bergamo East, Cardiac Rehabilitation Department of Siriate Hospital. Dr. Giudici, Viscardi, Regazzoni and Rizzola realized the course, Telehealth, Televisiting, Telemonitoring and Other Applications. Module 3. Step-by-step actions to implement telehealth. Lesson 3.5. Telerehabilitation. In this lesson, we will explain another application of teleassistance, the telerehabilitation. Let's get started. Telerehabilitation is the delivery of comprehensive rehabilitation services at distance using information and communication technologies, ICT, as the delivery medium. These rehabilitation services include therapeutic interventions, remote monitoring, education, consultation, and training and are intended to enable, restore, improve, or maintain the psychophysical functioning of patients from all age group affected by disabilities or disorders, congenital or acquired, transient or permanent, or at risk to develop them. Telerehabilitation has been developed especially as an additional tool to take care of patients after the acute phase of a disease to reduce patient hospitalization times and costs to both patients and healthcare system. This opportunity is also related to greater functional outcomes for patients. Telerehabilitation can also increase the efficiency of the rehabilitation services, allowing to take care of a greater number of patients and to reduce waiting times. Telerehabilitation also enables access to care in situations in which it is complicated for patients to reach traditional rehabilitation infrastructures, for example, for individuals that live in remote areas or for those who have mobility issues associated with physical impairment, access to transport, and socioeconomic factors. Telerehabilitation also provides the patient with a sense of personal autonomy and empowerment, enabling them to take control in the management of their condition and to become an active subject rather than a passive participant in their care. Telerehabilitation is a multidisciplinary activity and involves rehabilitation specialists, doctors, and physiotherapists that has to 1. Define together the objectives that can be achieved with the TR and the expected time necessary to reach them. 2. Identify the most suitable activities for every single patient, synchronous, asynchronous, mixed. 3. Verify the outcomes at the end of the TR path. Telerehabilitation uses different forms of communication technology, such as videos, websites, and computer programs to guide the patient and lead them through the specific type of rehabilitation needed in their individual case. Equipment may also be provided by the hospital or doctor that the patient can use at home. It is most often used to provide physical rehabilitation care to patients with neurological or orthopedic issues, but it can also be used in patients with recent hospitalization for coronary acute syndrome, ACS, or after cardiac surgery. In 2022, the Cardiovascular Rehabilitation Unit of Siriate Hospital, in collaboration with the telemedicine team, presented a TR project conducted on 4 patients after ACS, the cardiac surgery. The project objectives were: check the feasibility of a remote rehabilitation program, verify the compliance to TR of patients, and check the patient satisfaction through a questionnaire. The rehabilitation program proposed was a 3-week program with daily physical activity to be carried out at home and monitoring of parameters, heart rate and blood pressure, oxygen saturation, Borg scale, and 2 follow-up televisits per patient at the beginning and at the end of the program. After the telerehabilitation program, patients reported that they felt the accompanied towards resuming daily life activities after hospitalization, and that also TR was a great help to maintain consistency in carrying out the exercises prescribed. Telerehabilitation has wide-ranging applications, providing rehabilitative care to patients with many types of conditions and health problems. The feasibility and acceptability of TR technologies have shown significant patient and doctor satisfaction together with improvements in the quality of life. Thank you for your attention.